Well, Milwaukee County is growing a program that connects police and mental health professionals.
The I-Team's Casey Geraldo tells us how it is working during crisis calls. Casey.
Stephen Carroll, it's called CART, which stands for Crisis Assessment Response Team. A police officer pairs with a mental health professional. It has been going on since 2013, but a new team hits the streets this month, and CART tells us they've been able to stop people from hurting themselves, even before getting to a scene.
If you ask James Combs if he's better off now than before he met the CART team, he doesn't mince words.
Yes.
Until that January day, Combs was homeless, living in a downtown parking garage.
You got to worry about where you sleep, how can you eat.
He broke his ankle and pushed this button, calling police, who realized Combs was also in a mental health crisis.
I went to a hospital in order to have treatment and also spoke with a homeless outreach team.
Also known as a Crisis Assessment Response Team, or CART.
You have two communities that come together that are historically been handling the situation on opposite ends of the spectrum.
Officers like Cassandra Liebel, who pair up with a Milwaukee County behavioral health clinician to address 911 calls involving mental health issues.
What we really need to do is take a step back and look at why is that individual in that particular circumstance.
In Combs' case, it was a combination of bipolar disorder, schizophrenia, and other issues.
You need someone who's going to encourage you.
Clinician Maya Robinson explains that's part of the CART team's purpose.
There was a young lady that was thinking about taking pills. You know, she's in a bathroom, she wants to, end her life. She thinks it's the only way out. So you get on the phone on the way there and you start working on it right then.
In an extreme crisis, police officers have authority to take someone into emergency custody. But Robinson and Liebel say they want to avoid that.
Some people are in the middle where they don't really need hospitalization, but they're in a present crisis.
In 2017, CART responded to more than 1,200 calls. On about 600 of the calls, a CART team made face-to-face contact. Almost 90% of the time, they prevented emergency detention or hospitalization.
So if we can use CART to get them stabilized within the community and never having to leave out of the safety of their homes, then that obviously is going to have a much better outcome.
Liebel says it also saves taxpayers.
We've been able to mitigate a lot of calls just because of that kind of intervention.
Once the CART team makes contact, they can connect people like Combs with the kind of resources that can help them beyond their moment of crisis.
Because right then we have to mitigate that crisis and get that person safe. But there is some trauma in there that still needs to be worked out. So I think that's a big piece of it too. Just going back, digging, trying to see where it is and what it needs.
For Combs, that was stability.
That's my key to my door,
which he found at Pathfinders, a shelter for homeless young adults.
This is one of the keys to your future. So make sure you make your time count and have positive thinking.
This month, a fifth CART team hits the streets with West Allis Police. And the CART team tells us the number of calls that they get that can be addressed with a combination of mental health and law enforcement is quickly growing here in our area.
This is very important. Now, Casey, you said the CART makes contact with about half of the calls. What about the other half that they do not come in contact with?
For the rest of those people, sometimes they're able to get people to the right resources over the phone or just with a consultation with someone who might be able to help them. And we do have links to some of those mental health resources in our area if you or someone you know needs help.
Takes a new approach sometimes.
Exactly.
Yeah, thank you, Casey.